Good day, Ma'am Bautista. My name is Chanel Meza Mora Torres from BSN 2A, and today I will be doing a return demonstration about perineal care and perilight po. So, in order for me to do the procedure, first I will introduce myself and I will assess the patient episiotomy site for any redness po. So, I will start now. So, hi ma'am, my name is Chanel May Torres po, your student nurse for today. And today ma'am, I will be doing a perineal care, especially on your episiotomy site po ma'am. So, in doing so ma'am, I will be needing you to remove your underwear po ma'am. But rest assured that I will be draping your other parts of the body for your privacy. So, before I do that, I will first put on the curtain, and then next is I will do a hand washing po ma'am, and also putting on the gloves. So now ma'am, assuming na nakapag hand washing na po ako and nailagay ko na rin po yung gloves ko, now I will be assessing for the patient's episiotomy site po ma'am. So ma'am, tataas ko na po. And also, let's assume that the patient already removed her underwear po, ma'am. Sorry, ma'am. So, upon assessing the patient's episiotomy site po, ma'am, there is no redness. There is no redness, and there is a minimal swelling, and there is also no visible foul smell po, ma'am. And the discharge, ma'am, is pinkish to brownish na po siya, ma'am. And then, okay na po, ma'am. Now that I am already done assessing, I will now explain to the patient that I will be using, or the procedure that I will be doing. So now ma'am, that I am done assessing your episiotomy po ma'am, I will now do the perineum care po on your episiotomy site po ma'am. In this procedure ma'am, I will be putting, or I will be using irrigation solution or irrigating solution po ma'am. So, I will remove my gloves po ma'am, and then do hand washing again, and then put on another sterile gloves again ma'am. Also, i-ready ko na din po yung mga equipment na kailangan ko. So, yung mga equipment po na kailangan ko is yung water irrigation po. Water irrigation po, and then yung waterproof pad, as well as yung ano po ma'am, as well as tawag dito, bed pad po ma'am. Sige. Okay, now done with the Now done with the gloving po, ma'am. Now I will again expose the patient's episiotomy side po. So, ma'am, expose ko lang po ulit yung episiotomy, yung perineum nyo po ulit, ma'am. And then, after that, sorry, ma'am. Now, I will be putting on the um, bed pad. So, ma'am, sin ko lang po, ma'am. And then, talikod po, talikod. Tagilid po kayo, saglit po, ma'am. And ilalagay ko lang po yung inyo pong bed pad po. And then, on the other side po, ma'am. And I will also be putting the waterproof, I will also be putting the the waterproof pad po, ma'am. So, sorry, ma'am. Now, lalagyan ko na po, ibabalik ko na po ulit yung blanket sa patient ko. And then, expose ko po ulit, ma'am, yung inyo pong perineum area. So, after exposing that, ma'am, I will be needing you to flex your knees po, ma'am. So, ayan. Assuming na naka-flex na po yung knees ng patient ko. Now, I will now I will separate the labia po. So, using a cotton balls po, ma'am, I will be using a cotton ball and forceps po, ma'am. First, I will separate the labia po, ma'am, and then pour irrigation irrigation solution po. So, assuming na ito po yung irrigation solution. So, and then after that, I will dry, and then using a forceps and cotton po, ma'am, I will do the rule of 7. So, separate ko lang po onti yung labia ng patient, and then I'll do the rules of 7 po, ma'am. So, then on the other side, and then discard po agad after the 7s. So, yan, 1, 2, discard, and then another 1, 2, discard, and then sa ano naman po dito, gitna po, and then discard. And then after that, bubuka ko lang po ng onti yung labia, and then 1, 2, discard, sorry, 1, 2, discard, and then 1, 2, discard, 1, 2, discard, and then sa gitna po, discard. So after that po, I will use dry cotton naman po, ma'am. So, discard, and then discard. So, after po nyan, I will use sterile pads po. I will put it on the patient's dadry ko lang po ng konti yung perineum area ng patient, and then I will put on the sterile pads po. So, yan po. And then, susuot ko na po yung underwear po ni patient. So, ma'am, I'll help you na isuot na po yung inyong underwear po. Okay po, ma'am. Then, on the other side po. So, after that, I will drape the patient po. So, ma'am, I'll remove your blanket first po ulit. And then, I'll remove the pads po. So, okay, ma'am, tagilid po ulit kayo. And then, on the other side po ulit, ma'am. Then, after that, I will discard all of the equipment na ginamit ko. But, so, assuming na lang po na na-discard ko na siya on a yellow bin po, I will drape the patient accordingly po. So, ayan po. And then, after discarding all the necessary equipments that we use, including my gloves po, I will do a hand hygiene po. And then, after, assuming na lang po na nakapag-hand hygiene na ako, now, I will document all the things that happened on the patient, including po yung mga nakita ko po sa patient, which are, there is no redness, there is minimal redness, and there is no redness, and there is a minimal swelling. There is no visible foul smell. Also, there is discharge which is pinkish to brownish po, ma'am. So, that's all for perineum care. And then next is the perilight.